Okay, my name's Lynette Campbell, and I'm going to be demonstrating today how to catheterize a female patient. I will do the male patient audio only, referring to this video as well. This is skill 29.3 in your book. Okay, and I'm going to do this skill with the book so that you can follow along with me on the steps, because it is very detailed. So first of all, it talks about your supplies is an indwelling catheter care kit, and then you have sterile gauze, which it says 4x4, but you just need a little bit of gauze. You may not need it at all, but it's here in case we need it. And then it talks about a basin with warm water and a towel and washcloth and some mild soap, the catheter securing device, and then an extra light, a standing lamp or a flashlight. You can also use your pen light, okay? So that would be your supplies. Now, an indwelling catheter is used because the patient cannot void, or if the patient must undergo a long surgical procedure, or sometimes just to measure input and output, okay? They do not do them as often as they used to because of the risk of infection, but they still are used, obviously. Now, let you know up front, this is a sterile procedure, okay? So you have already had your class on opening sterile packages and maintaining a sterile field and stuff like that, okay? So I'm not going to elaborate a whole lot on that, just some slight reminders here and there, okay? So the first thing on step one, on this skill, it says check the primary care's order for the type of catheter, okay? You have to have an order to put in a catheter, and then you want to see what kind he wants. There's several different kinds. This is a 16 French, and like I said, you will read in your chapter and gather the information on that. Assess the patient's knowledge of the catheterization by use of a catheter, okay? You're going to teach the patient, okay, I'm fixing to put in a catheter, and this is what it does, and this is why we're doing it. I'm not going to go into all that. Very important, this is one of your test questions. You will assess the patient whether they're allergic to iodine or tape. You have to ask them if they're allergic to iodine or tape, because iodine and tape will be involved. All right. Assess the woman's ability to assume the dorsal recumbent position, which is also known as the lithotomy position, and that is basically she's able to lay on her back, lift her legs a little bit, and literally be able to spread her legs and relax her hips, rotate her hips outward. Some people cannot do this, in which case you would have to do the side lying position, which is in your chapter as well. Would not be as easy, but it is doable, obviously. So you will assess to make sure the patient can do this, okay? All right, check the patient's identification band. You're going to assess and see, make sure you have the right patient, the right equipment, and introduce yourself, all the standard, okay? All right, you're going to close the door for privacy, pull the curtain, okay? Because again, that's standard procedure by now. You should know this. And then, like I said, we're going to explain the procedure. I'm going to tell a patient just what I'm doing. You perform hand hygiene, which I'm going to do, and I'm going to don disposable gloves. These aren't sterile yet. These are just regular disposable gloves. Patient will already be in a lithotomy position. And what we're going to do is, that's what the soap and water is for. I'm going to wash this area really good around where I'm going to be working. I'll wash everything. Just wash. Get real good. Okay. We'll rinse. Soap up, wash again. And then I'm going to use my non-dominant hand to actually look for the meatus. The meatus is always a canal with an opening at one end. You have several of them on your body, okay? What you're looking for is this. This is your meatus. I promise you it's not this big in real life, okay? So what you're going to do, you can use your pen light. You're going to use your non-dominant hand. You're going to use your pen light, and you're going to spread the labia apart and look for it. The meatus that we're looking for is going to be between the vagina and the clitoris. There's the clitoris. There's the vagina. There's the meatus we're looking for, okay? As a female gets older, it's going to be really hard to find this, okay? So you need to really look and pull and look around till you feel like you found it, okay? So it's going to look like the vagina. So you got to look. It's between the two. There should be a hole between the two, okay? All right. Now that we've established where that's at, you could even, the book said you could have an assistant to help you look if necessary with holding the light while you search for it. The book has a very good picture on step 10. All right. Now you're going to remove gloves and perform hand hygiene. Okay. That's what I'm doing. Moving gloves, hand hygiene. Move my water. Okay. I'm going to keep one of these close in case I need it, and I'll explain what it's for later. Okay. All right. Open the plastic covering of the catheter kit by tearing along the perforated edge. So that's what I'm doing. I'm tearing it. As you can see, I've already practiced with this kit. Even if you've done it a little while, you need to practice. You're going to place the kit between the legs of the patient about 8 or 12 inches away because you need room to work, okay? You're going to take your bag. You can fold down the edge if you want to. And you're going to place it at the end of the bed to discard anything you need to get rid of. Okay? All right. Now it says, fold back the corner of the bath blanket, draped exposed perineum. So that's what we're doing. We don't want to expose no more than we have to, just what we're working on. There we go. Fold back the corner, okay, that's folded back. With clean hands using sterile technique, open the wrapper and use it as a sterile field, provides a sterile field. So that's what I'm going to do now. My hands are clean, and you know your sterile fields. You're always going to open the one away from you first, and you do that because you don't want to be reaching across your sterile field once you get it made. And you want this to stay. So you can touch the edges, and you want this to stay over. You don't want it to come back on you. Same thing with this one. Remember, the inside is your sterile area. Okay? Anytime you open a sterile package, you're going to be fighting it wanting to come back on you. And there we go. So everything in here is sterile. All right. It says, okay, I have sterile gloves here, okay, and the package is fine, so I'm going to lay my package right here because outside the package is not sterile. I'm going to lay my sterile gloves right there. Pick up the sterile absorbent underpad by the corner, hold 2 corners, fold over your fingers, and slip it under the patient's buttocks, plastic side down, okay? The patient should be able to lift up. So you're going to grab this by the corner. You're going to open it up. Okay. There's your shiny side down. Okay. What I'm going to do is I'll hold this right here, and then you're going to take this and you're going to wrap it around your fingers like this. Fold them towards you. Okay. You want to fold it towards you like this, okay? Just like this. And what you're going to do is you're going to put this under the patient's buttocks. You're not touching your sterile field, okay? So you're just going to put it under the patient. The back of it's fine. And this is an artificial piece, as you can see, but you get the point. You would scoot that up underneath the patient's buttocks, shine it side down, okay? All right, now it says touch only the corners and the underside of the sterile underpad. That's what we done. Put on the sterile gloves and separate the 2 containers in the kit. Placing the tray, this is step 16, placing the tray with, it says cotton balls in your book, but we don't have cotton balls in iodine. We're going to have iodine sticks, okay? So I'm going to put on my sterile gloves. Okay, so you're going to do the outside of the glove. It's a lot easier because I've already had them on, so don't let this fool you. All right, then you're going to reach, because this hand is sterile. Sterile to sterile is fine. Okay, pick this up. I'm going to stay on the inside with my boo-boo. Sterile to sterile. Okay, now placing the 2 trays. So there's 2 trays here. This is still sterile. I'm sterile, so I can lay this right here. Okay, I'm going to take the 2 trays. I'm going to scoot this tray down. I'm still on my sterile field. And I'm going to set this right here. In fact, I'm going to set it like this. You're still sterile to sterile. Everything's sterile. And that's only dirty because I've done got into it. Okay. Now, place the drape with the opening over the genital area, exposing the labia. Okay, this is the drape with the lobe, with that. Everything is sterile here. This is going to help right here, and this is the iodine got on there from the kit where I had it open while ago practicing. This is going to go right over this right here. And what that does is, in case the catheter touches anything, you still got a sterile field here on the side of the legs. Okay. He said loosen the cotton balls. This is step 18 from one another. We don't have those. We have the antiseptic sticks that you can see right here. And we're going to use those instead. Okay. Open the package of lubricant and remove the stopper from the syringe containing it and squirt it into the open area of the tray. Okay, we don't have that. We have a package. So I'm going to open up this package. Okay, and I'm going to squirt it in the tray. Everything in here is sterile. Okay, everything is sterile. I would have opened this, okay, like this, and this is it. So you're going to maneuver that around where these are sticking out. That's in place of the cotton balls it talks about in the book with the same iodine on them. Okay, here's the stopper for your syringe. You can go ahead and take that off. That's going to be used for filling up the balloon. All right. Now it's going to say, step 20 says place the sterile specimen bottle on the side of the tray or discard it. Okay, we don't need that. We don't need that, so we can just chunk it. Open the package of lubricant. We've done that. Now we're going to do step 21. Remove the plastic sleeve on the catheter by tearing it down the perforated side while carefully controlling the catheter. Place the catheter within the sterile tray where it can easily be reached. Okay, the catheter is rubbery and can flip or jump and strike a non-sterile surface if not controlling it. Wrapping the catheter around the gloved hand while tearing the sleeve helps prevent a break in sterile technique. So that's what we're going to do. Okay, as I'm unwrapping it, I'm going to wrap it around my hand just like this as I'm pulling that off. That way it's not just jumping around everywhere. Okay, so there's my sleeve. That's off. And now I'm going to lay it back down in here. Okay, we don't want it flopping around. You got to control it. It's rubbery. I said it's sterile, so you want to lay it right there. All this is sterile. All right. Attach the sterile filled syringe to the balloon port on the catheter and leave the syringe attached to the catheter balloon port. Do not pre-test the balloon. So that's what we're going to do. Again, I'm going to pick this up. We do not want to touch any part of this to anything else. Okay, you can do it like this. This is your sterile balloon port. So I'm going to attach this, and I'm just going to leave it attached. Okay, now you've got the whole thing there. All right, everything in here is still clean and sterile. Nothing's moving around and hitting nothing. If the syringe is detached now, you just have to reattach it later. So we're going to leave it on there. That's just going to be our way of doing it. We're just going to leave it on there. With the forefinger and the thumb of the non-dominant hand, separate the labia minora, exposing the meatus. Pull slightly upward. Leave the hand in place because now this hand is contaminated. So that's what we're going to do now. Okay, we'll pull this up now. Now this hand's contaminated. My left hand is no longer sterile. Okay, and we're going to take the iodine sticks, and you would take one. Remember, you're operating one-handed now, and I'm not going to touch it, but you go down this side. You could chunk it. Get out another one. Cotton balls will work the same way with the forceps if that's what you was doing. You'll go down this side, chunk it, and then your third one, you go right down the middle. You only use one stroke per swab, okay? No backtracking. So now you got this in here, okay? All your stuff's out of your way. All right, now this hand is dirty now. All right, so now you cannot let go. Once you've got the labia sanitized, you cannot let go. So everything now is all straight one-handed. Pick up the catheter about 3 inches from the tip, lubricate it well, and gently insert it into the meatus while pointing the catheter slightly toward the umbilicus. That's your belly button. So you're going to go in and kind of up. And you're going to go about 2 or 3 inches until you visualize urine flow. After you see the urine flow, insert an additional 1 to 2 inches. So here I go. I'm going to lubricate it. Okay, now I've never let go once I started. And hopefully we can see urine in here come out because there's supposed to be some in here. See, you see urine. So we're in the right place. Okay? Okay, we're in the right place. Now we're going to inject the balloon, which I'm not going to do because I'm not going to put water in there. But I would fill up the balloon now. I'm going to go a little bit further. So you can go another 1 to 2 inches. Make sure you're in the right place. Fill up the balloon. And then I'm going to give it a little tug to make sure it's in place. Okay? But I do have urine. Okay? Alright, now, the patient will feel like a little pinch, and that's where it's actually going into the bladder. You can have them, you can read all the things, or you can have them hold their breath and different things. If there is as you're advancing, if you see a look on their face when you blow up the balloon, it could actually be in the ureter, and that's not good. You need to immediately pull out the fluid. And I'm going to go ahead and take this out right now. You'd immediately take it out because that could damage the ureter, obviously. But from here on out, I'm going to show you, because this is still leaking. I was trying not to use all my urine in my mannequin here. The important thing is that you're going to have that it's in, they're comfortable. Now, just in case, maybe you got in there and you didn't see any urine, and you know you should have by now, and you realize that you're actually in the vagina. Okay, do not take out the catheter. If you're in the vagina, leave that catheter in place. Okay, tell the patient that you're going to get another kit. Leave that one sitting there just where it's at, and you will go get unglove, wash your hands, and get another catheter kit, or maybe you can use your elbow and get the call light and have the nurse bring you one. but you're going to have to start all over, and you're going to know that the meatus that you're looking for to go to the bladder is going to be just above the hole you're already in. Okay, so if you find out that you are in the vagina and not the meatus headed to the bladder, the ureters in the bladder, then you leave that one there. Do not pull it out, because you don't want to hit the wrong hole literally twice. Okay, so I'm just going to pretend this is still in here. Okay, all right. This would then be, I would detach this, because this is like an empty syringe now. Okay, the balloon's blown up. Now, the bag, that one's supposed to come out, so let's just assume it's still in there. Okay, we're pretending the catheter's still in there and it's got a balloon behind it. Okay, the bag itself will be hung on the side of the bed. It has to be a part of the bed that doesn't move, so obviously it's not going to be on the rails that you hang up. So you can hang it like on the frame of the bed. And like I said, it's hard for me to show this because it's all leaking out there. But you're going to put it like on the frame of the bed. Okay? And you want it somewhere. In fact, this one has a little spot for it, so you could actually put it down here. Okay, you can see the urine going into the bag. And the thing about it is that this is, you will attach the catheter to the patient's leg right here. There's an attached device that you can put right here. Sometimes it's taped, sometimes there's a Velcro strap that holds it in place, but that just keeps it from moving so much, because obviously the patient moves, they get up, and so forth. Okay, but the important thing is, I want you to remember, all you want hanging over the edge of the bed is the part that's leading to the bag. I think this one could actually go 2 spots. That's good, right there, look, that's perfect. So you want the rest of this catheter, what part? So here, you want it curled up here on the bed, like this. What you do not want is the urine making a loop right here. You don't want it hanging down the side of the bed with that urine sitting up there. You want it to drain freely into that bag at all times. So the catheter would be in the patient right here, and this would be curled up on the side of the bed. And see these little pincher things? Boom, there you go. That can go to the pad. You can go to your sheet, okay, and that keeps that from coming off the edge of the bed, because you want the free flowing right here with no loops. Okay, and of course the rest of the procedure is you make sure the patient's comfortable. You're going to clean up. Like I said, we're pretending the catheter's in there. I can always put more urine in, I guess. Okay, clean up all your mess because it's just dirty now, so you can just get rid of everything. Cover up the patient as soon as you can for privacy. And all this will be disposed of properly. Everything is dirty now. Alright, and then you remove your gloves. Your sterile gloves, because now they're no longer sterile, they're dirty, and you remove them like you've been taught to do. And like I said, I will put a male instructions for this, referring to this video for the male, to accompany this video as well. And follow it step by step, and I suggest you practice a lot. Thank you.